and public health expert with the Aurum Institute, Geoffrey Setswe, says the NHI is no different to any other structural change implemented in the health system. Professor Setswe says, however, implementing it in South Africa will be a challenge, and I want to talk more about it with him. Prof, good morning. Thank you very much for your time. We appreciate it. What's alarming is that despite months of debate, months of engagement on the concept and the application of NHI, a number of people still don't know what it is or how it will affect them, and this bill is likely to be signed into law by the President later today. So talk to us about how people can just simplistically understand this. And I know that you're a champion for NHI, and we'll talk about why in just a moment, but just the basic understanding of what this is and how this will affect the lives of people like those who live near the Tembisa Hospital.
Good morning, Imani, and the viewers. The signing of the NHI was overdue, and we had expected at this stage that the public would be in support in general of this transformational piece of work. But it's disappointing that the focus has always been on the concerns which were not dealt with. If we look at the timelines of the NHI, it was approved in 2007 at the ANC conference in Polokwane. And from then on, in 2007, we had a green paper. And in 2011, we had a green paper. In 2015, we had a white paper to clean up all the misunderstandings that could be there and to make inputs from people in the public. 2017, there was a policy paper on the NHI, and since 2019, we've had the NHI bill. And all these steps were characterized by having public consultations. But the big mistake with these public consultations, instead of explaining what the NHI is about, how it will benefit the public, and how we can deal with the challenges, we were not able to carry the public into our confidence. We expected the 86% of the public who are using public health services to be excited about the NHI and to support the signing of the NHI. And if there were challenges, these challenges can be ventilated in court. But an ordinary member of the public struggles to understand what the NHI is about. And the key principles of the NHI are so clear that if we have access to healthcare, irrespective whether you are rich or poor, employed or unemployed, if we have equity dealing with the inequalities in health access, and if we have the better quality of healthcare than what we see in the public healthcare services, we had expected that most South Africans would have supported the NHI. But it has been an enigma because a lot of time was spent on the concerns which were never addressed by the state and the parliament.
And the argument that has been made since the very beginning continues to be made for today, I think a lot of people would agree with, from a moral and a philosophical perspective, to undo how it's been characterized, a kind of healthcare apartheid in our country, access to the best healthcare only for those who have and not for those who have not. You also asked the question in this piece that you penned for the Daily Maverick around why civil society isn't championing the cause, because healthcare is a fundamental right. What are your thoughts on why that's the case, as you see it?
Yeah, we can always say if we do not have water, if we don't have electricity, if we don't have basic needs, but we do not have a strong movement in South Africa to advocate for health. And this is sad because healthcare, as is part of Section 27 of the Constitution, is a basic right. And I would have liked to see, public organizations coming out to support, the establishment of the National Health Insurance and make contributions that would have dealt with some of the concerns that have been raised. But I think politics was far above, the ordinary elements of the NHI. That South Africa has become very complicated. That issues that are supposed to be community issues that are dealt with by members of the community are now abrogated to the politicians to make final decisions on. And it is the politicians and the state that we do not trust. We don't trust the state to handle the money that's going to go into the NHI fund. We do not trust them to provide quality healthcare. Neither do we trust them to appoint, the right people to the boards of the NHI that are going to be there. And that is why there's going to be all these legal challenges that are related to this.
Professor Geoff Setswe, I'm so sorry to end our conversation there, but as you say, there are a number of, and as you've written anyway, that there are a number of resources for people to really understand. It does need to be proliferated in very simple terms to everyone who's going to use it, including, my mother who lives in Pietermaritzburg, for example, who's not always plugged into the mainstream of these debates, and we will certainly continue to have them because there is the potential for lawsuits, there is the potential for a number of things to unfold once the president, who is expected to sign it later today, does so. So we'll definitely invite you back. But I want to thank you for making time for us this morning, Professor Geoff Setswe, Managing Director at the Aurum Institute.